Can you straighten your teeth outside of a dental office without having to see a dentist or an orthodontist? Because nobody wants to see us people, right? Nobody wants to see a dentist, come on. Do direct-to-consumer tooth straightening services and trays, do those work? These may work for some patients, but only if you have very little movement to accomplish in certain areas of the mouth. There are lots of problems, potential problems, lots of them, with using these services, so let's go over a few of those. Potential problem number one, you can mess up your bite. You know how your teeth come together? It's kind of important. If you have any current jaw joint or jaw muscle problems, or any history of jaw joint or jaw muscle problems, I strongly advise against using a service to straighten your teeth that doesn't have you face-to-face with an experienced orthodontist. I've seen patients who have used these services and made their jaw pain worse. I've seen that a number of times. I've then referred them to an orthodontist to fix it. So then you're spending double the money or more. You know what I mean? Here's my whole thing. If problems arise during treatment, it's kind of nice to have a team of people close by dedicated to helping you, right? It's not fun waiting on a customer service line with someone who has no dental knowledge trying to resolve problems you're having with your orthodontic treatment. Potential problem number two, cavities. If you're going to have any orthodontic treatment, whether it's through a direct-to-consumer service or with a dentist or orthodontist, it's really important that you have had the health of your teeth checked prior to starting that treatment. It's really important. You really need to have excellent oral hygiene habits at home, and you need to understand healthy eating and drinking habits to avoid cavities before you start orthodontic treatment. Wearing aligners or having braces can make you more likely to get cavities. Food and drinks cling to braces and they get trapped against the teeth if you're wearing clear aligners. It's super important to clean your teeth thoroughly after you eat or drink anything that can cause cavities before you put your clear aligners back in, right? Super important. I have lots of other videos on my YouTube channel that explain the ins and outs of avoiding cavities. Here's the thing, cavities are 100% preventable. Even with braces or clear aligners, you don't ever have to get a cavity. You just need to practice the right habits. I want to help you know what the right habits are. That's my goal. So if you have any existing decay on your teeth, you need to get that fixed with a dentist before you start orthodontic treatment. That's important. Okay, potential problem number three, making gum disease worse. If you have existing gum disease, it's important to get that under control before you start moving teeth. Gum disease breaks down the gum tissue and the bone supporting your teeth. The way teeth move is by applying pressure to the bone and breaking it down. And then as the tooth moves through the bone, new bone has to form around the tooth. The problem is the inflammation involved in gum disease messes up this bone remodeling process, and it can lead to lots of bone and gum tissue loss accelerating in your mouth if you try to move teeth through the bone when it's not healthy. This can make your teeth look older due to gum recession, and it can make your teeth loose, so you're more vulnerable to losing teeth over time. Exposed root surfaces of teeth from gum recession are also more vulnerable to getting cavities and can be more sensitive. Gum disease can't really be assessed without visiting a dentist in person, so you need to check off that box and make sure you have healthy gums before you start any orthodontic treatment. Potential problem number four. Sometimes there is not enough room in the mouth to straighten your teeth without additional dental procedures happening first. Sometimes this means removing teeth to reduce crowding prior to starting orthodontic treatment. Sometimes it means reshaping in between the teeth to make them thinner to help reduce crowding. Sometimes you need to have your entire mouth expanded to make room to resolve crowded teeth. All of these require face-to-face interactions with a dentist or orthodontist, not stuff that you can do with clear aligners outside of a dental office. Potential problem number five, airway and breathing issues. This is a big one. It's a topic that has blown up over the past 10 years or so in dentistry. Lots of people are talking about this now. I mentioned that I had 4 teeth pulled when I had my braces as a teenager. That was done to help straighten my teeth to reduce crowding. And it looks pretty, I guess, kinda. I don't know, tell me what you think. However, there may be some risks of developing functional problems when you approach orthodontics this way. What do I mean by that? Well, when you pull teeth, you end up shrinking the size of the mouth. the bone that those teeth used to occupy goes away. Your jaws don't grow to be as large of a size as they otherwise would have. This can crowd the tongue back in the mouth, and for some, definitely not all, but for some patients, it can leave you more prone to issues with obstructive sleep apnea. Obstructive sleep apnea is when the soft tissues of the mouth and throat close off the airway while you're sleeping. That loss of oxygen causes issues with getting low quality sleep, spiking your blood pressure. It has all sorts of negative, no good, long-term consequences, bad health consequences, heart problems. It's not good. We don't want that. And again, you can't assess someone's level of risk for these sleep apnea and breathing issues by only looking at their teeth. You have to look at their mouth, throat, facial structure, nose, overall size, body weight, angulation of their jaw. There's a bunch of factors that contribute to risk level for this. So if you're going to be making decisions about how you might be permanently changing your facial structure, and airway, I would suggest working with someone who can evaluate you as a whole person and go over your entire medical history with you, rather than just shipping off an impression of your teeth and rolling the dice that a treatment plan that may help your teeth look a little better isn't going to mess up how you get oxygen into your body. Oxygen is kind of important. It's pretty fundamental. It's pretty fundamental to how we, make our way in the world. Oxygen. So if you want to learn more about breathing issues and how they relate to dentistry and orthodontics, there are a couple of books you can check out. One is called Jaws by Sandra Kahn and Paul Ehrlich, and the other is called Breathe by James Nestor. They both cover a lot of the same material and make a number of the same points. Sandra Kahn is an orthodontist, so her book may be more useful in making decisions about how you want to approach orthodontic treatment working with your orthodontist. James Nestor's book talks about a lot more than just dentistry, and you may find some of the breathing exercises he discusses to be more immediately practical and helpful in your everyday life, even if you're not pursuing orthodontic treatment. The alternative to removing teeth or reducing the size of teeth to fix crowding is to try to expand the jaws, bring them out, bring them forward. And that's not easy to do either. It involves behavior change on the part of the patient while you're growing. If a dentist or orthodontist isn't careful when trying to expand the teeth outward and forward, they can cause lots of bone and gum tissue loss from the jaws as they face out toward the cheeks. This can cause gum tissue recession. Doesn't look good. Makes the teeth more vulnerable to decay, sensitivity, tooth loss. So if you're going to try to expand your teeth and make more room in your mouth to widen and broaden and bring your mouth forward, you better be working with an orthodontist who knows what he or she is doing. That's my 2 cents on the topic there. Potential problem number 6, dental implants and bridges. If you've had dental implants placed, these cannot be moved orthodontically. Once an implant is in the bone, it's stuck there. So if you're planning on getting a dental implant and you want to do orthodontic treatment, you need to do the orthodontic treatment first, then place the implant after all of your teeth are aligned how you want them. Ideally, the same goes for having dental bridges done to replace teeth. It's a lot tougher to move a bridge once the teeth are tied together, so you should do the orthodontic movement of the teeth first, then place the bridge once the teeth are in their final position. Again, if you just send an impression off through the mail, they may not know which teeth are dental implants or dental bridges, and that could screw up your treatment because the teeth won't move how the software predicts that they should move because they aren't natural, normal, original teeth. Okay, so this brings us to definite problem number 7. You can't place composite buttons on teeth through the mail, right? Composite buttons are these little weird shapes of dental filling material that we attach to the outside of your teeth, and they're really important because they allow clear aligners to torque your teeth and move them in very specific ways. Without these buttons to grab onto, there's a very limited range and type of forces that can be placed on your smooth teeth by clear aligner trays. The ability to shift teeth is quite limited if you're just shrink wrapping plastic around the teeth without any composite buttons to help guide those forces. You really need a dentist or orthodontist to apply these buttons. It requires seeing someone in person so they can do a simple procedure in your mouth. Without these, you can only treat pretty limited, relatively simple cases with clear aligners. Last issue to talk about here, potential problem number 8 with clear aligners through the mail. Straightening your teeth may not resolve other potential issues you have with how your smile looks. For example, what if your midline is off? Typically you want the midline of your teeth, the place where your two front teeth meet, to be in the center of your face and to be straight up and down perpendicular to an imaginary line between the pupils of your eyes, right? So midline, pupils. I don't know if that's making sense, but if you're not looking at the whole face and you're only looking at the teeth, you could have a cant to your midline where, it's slanted and it could be off center too much, and, that could look weird in photos of your whole face. What if you don't like the amount of gum tissue that you display when you smile? That can be modified, but your dentist or a periodontist, that's a dental specialist who works with gum tissue, should be talking to your orthodontist about how to fix that and at what stage of treatment to do it. What if you don't like the size, color, or shape of individual teeth? Your dentist and orthodontist should be talking about plans to fix that, and the teeth should be aligned to work for that final plan to place bonding or veneers on your teeth after the orthodontics are complete. If you do the orthodontics and you aren't consulting with a dentist about fixing teeth afterward to improve the look, then the teeth may be aligned based on how they look now and not based on how they are going to look after some cosmetic dental work. That can mess up the final result. Also, what if your teeth are worn down or chipped? It's possible to create space between the teeth to help with fixing this problem so you have a full smile again, if your dentist and orthodontist are planning things together ahead of time. But you have to plan it ahead of time. You have to move the teeth for the final treatment plan. What if you don't like the position of your lip? Pulling your teeth back can make your lip look thinner instead of more full. That's a consideration. All of these things should be discussed with your dentist and orthodontist if you want to have a predictable result in the end. Or you could ignore everything I'm saying. That's cool too. But I feel obligated to at least make an effort to inform people about this stuff, because most people don't know any of this, and it causes problems. It's not good to not know stuff and have treatment done and then find out about problems later. It's better to know about the problems ahead of time, I think.